Hello. Good morning, Divyan, Megha. This is a new series that I'm going to start here on special classes as well. This MCQs. So it is going to be mixed MCQs. Okay. So today is the day one. We are going to have MCQs from head and neck region, upper limb, lower limb, etc. Yeah. Good morning, Megha. Good morning. All right. So this is my introduction. You must have seen this introduction many times. So I'm not just going to, read it. I'm only going to talk about the referral code, why it is important. The referral code is ROHINI. So this referral code is very important. Why it is important? To access all your classes. So you want to access some of the free stuff like the quizzes, test series, and other stuff that are, put up at Unacademy platform. You have to use the referral code. Okay, so this is ROHINI, and there is another code ROHINI10. So either of them you can use. It works equally well, and you will be able to have access to all these things. It is for your benefit only. So I suggest you try this. Okay, so that is one thing. You can use with even plus subscription. So you will get this 10% discount when you do so. So try using the code. You will save some money when you do the subscription. There are various other options. Let's see what other options we have in the subscriptions quickly. Okay. So these are some of the dedications that my students have given. See, when you, have put in so many minutes to your watch time, like 1,000 minutes. Here, a student has 100 minutes, then there is some 10K minutes, all these minutes of watch time, and they are benefited. That's the reason they have dedicated these hats to their educators. So you can also do so. You can also go to my profile and see uh, what students have to say. They have messages as well. They have written why they dedicate these hard-earned hats to their educators. You can watch all that. You can see the messages, and you can also see so many followers are there. You can also follow me on my profile, Rohini YN, ROHINI YN. Okay, that is the spelling. And there is this username as well. Even using this username, you can find me. So for all this, you need to have this Learners app. Learners app you can get from Unacademy. Learners app is there at Play Store as well as the App Store. So just look for that. There are two apps. There is one for educators, another one for learners. So don't get confused. This is Learners app. All right, don't get confused. I have always seen students getting confused and they say that we don't see any options. So this is a different app. So please look for the proper icon and just download this, and you can find me under this section NEET PG. Okay, so once you find, then everything just follows. If you just follow the instructions and you're there at my profile. So you have so many more. See, you can see the difference. It was a few hats and then it goes on. So the number of followers also increases. As that increases, the number of dedications increase, the number of classes increase. And you can see all my classes that I've put up on YouTube, especially the neuroanatomy. I'm sure you neuroanatomy classes, not many would have covered, and it would really interest you. I have covered most of the topics. Please go look for those neuroanatomy topics on YouTube. All right. And this is my credentials. You can go read up more on the profile itself. And when you go for plus subscription, you get this 10% discount when you use the code ROHINI. So use this code. That's my name itself. So you will be able to get this 10% discount. And what do you get with the plus subscription? If you ask me, you get access to daily live classes, the test series, structured codes and unlimited access to many more things. Okay, that is not so when you are using just the free classes on YouTube or special classes. So this has much more advantage, and if your goal is to just reach there in time and not waste many years or not waste any time at all, then you should go for Plus subscription. Okay, we have so many students saying good morning everyone. Then we have Iconic subscription, where you have one more advantage, that is the best of Prep Ladder also is added with your subscription. So the kind of curriculum that you get in Unacademy, you can also expect in the Prep Ladder. So there is this limited time offer. Please go grab the first 500 would be the lucky ones to get this offer. And also there is this new thing that I must say, July 10th, mark your calendars, and it is at 8 p.m. Topic is pathology slides. Your chance to big win is here. That is, if you are the first rank holder, you would be getting 100% scholarship. So I'm motivating you right in the morning, right? Akhil, Shakti, what do you say? This is really motivating. You can get 100% scholarship. That is on 1 year plus subscription. You can also get many other scholarships. You can go for 75% scholarship if you are second to fourth rank holder. 5 to 9, 50% scholarship. 10 to 19, 25% scholarship. So many could get benefited. If you want to be one of them, then you can just go for this MedMind scholarship test, that is on 10th, 8 p.m. Okay, so there are so many other small offers. See, 3+1, 4 months subscription you can go for. If you think you have already studied and you have sufficient knowledge, you just need to test it, go for this. And 12+2, something similar, where you can have access to the Unacademy platform for 14 months. So where you have a lot of things to discuss, lot of things to download the PDFs and many test, quiz, interactive sessions, all that you can attend. And there is something new, that is 4-year subscription. If you are thinking that you're underprepared, you need to start from your UG itself, and you are in a UG level right now, then this is right for you. Okay, so for medical PG aspirants, from the foundation itself, you can start preparing to NEET PG at one single place, that is Unacademy. Okay, so you can start right now. If you are in second year, first year, this is also good for you. So INR 60,000 plus subscription, and Iconic subscription 75. All this is really interesting and pocket friendly. If you work it out, this really works out to be really pocket friendly. So for all this, you need the code. Don't forget my code. So use the code anywhere it asks for the code. Okay, this is the code. Raise your hand, ask a question. This is a new feature that is there, and that is really interesting because we can make it like offline class instead of online. It is two-way. You can also ask questions, we clarify your doubts, and it need not be carried to the next day. So this is a nice feature that you can see. And professional year batch 1 starts from 7th. That is just yesterday it started, and there is last mile to NEET PG. That also starts on 7th. You're not late, you can still join. Target Next 2022, that starts with the 6 months duration, starts on 7th July. And this also has nice curriculum designed. And Focus FMGE batch starts on 7th. That also is 6 months course with good curriculum, like all the interactive doubt clearing sessions, whatever you can think of, because we do take feedback from the students and only then it is designed. So this is a interesting thing. 48 months now. Before 36 months would attract some EMI. Now it is 48 months will attract 1,125 per month EMI, and with minimum of 6 months you can get this offer. So try this, but use the code ROHINI. All right. Next, shall we start now? Okay. So we have Dhruti, we have Sakti, and we have many, many more. And it is already gone scrolled up. So let's see who else is there. Panda, Araksha, and we have Megha, Debyan, and yes, Nirupam. All right, good morning, Rishabh. Good morning, everyone. All right, the first one, the breast is supplied by. The breast is supplied by. What are the vessels that supply the breast? Is it, so you can just answer your questions right here. You can just message it off. Okay, I'll just see the messages. The breast is supplied by, what do you think? Just take a guess. Lateral thoracic. Is it lateral thoracic? Internal thoracic? Intercostal. See, all these are present in that region only. So you just give it a thinking. Intercostal, yes, it is right there. Internal thoracic. Internal thoracic is where? It's a branch of which one? It's a branch of subclavian, direct branch from the subclavian itself. Yes. And lateral thoracic, anybody? It's a branch of which one? Branch of axillary. So axillary region also could be, supplying this breast region could be supplying from this artery branches also. So since it is thoracic, it is definitely supplying the breast. So the answer, I would say, if you don't know, just go for all of the above, which all of you said. Dhruti said D, Debyan said D. So the answer, I am also thinking it is D. Let's see, is it right? Yeah, answer is D. The blood supply of breast. For little explanation, you please keep some patience. And there is axillary artery. You know what are the branches of the axillary artery? There is superior thoracic, thoracoacromial, lateral thoracic, subscapular. All right. So these are some of the important branches which are, in this direction. And you can see that internal thoracic, which is a branch from the subclavian. So anything, after this first strip is axillary. So this side is all axillary. The other side, you can see, this side is subclavian artery branch. So only one you can see, that is internal thoracic. It's a branch from the subclavian, and that also supplies by its perforating branches to the anteromedial part of the breast. So you should remember anterolateral. This portion of the breast is very, very, very much asked. Okay. Anterolateral. Breast is supplied by which one? You should know this. Anteromedial is supplied by which one? So you study like this. Anterolateral by these two, that is thoracoacromial and lateral thoracic. The anteromedial is solo supplied by the intercostal and internal thoracic vessels. So this is very, very important. All right. Next, yeah. Thank you. Let's go to the next one. Okay, now you tell me, in the preparation of neck dissections, okay, this is a scenario-based question. In the preparation of the neck dissections to removal cervical lymph nodes due to some metastasis, the surgeon gave the junior, doctor a task of, they usually ask you, when you go to PG, they ask you questions before you, even touch the patient. So this is describing the lymphatic drainage of the head and neck. He asked him the following questions. Now, the lymph from the posterior part of the scalp. Why do we give all these scenarios? So that you can recall and imagine a scene. Okay. Always scenario-based questions will, stay in your head. Don't ignore this. There could be some keywords. Even in the exam, when you attempt any exam, you should look for the keywords. Just don't ignore any, paragraphs. From the posterior part. So this is the keyword of where? Scalp. Now where it drains into. Anybody? Is it buccal? Buccal is in front. No. Is it laryngeal? It is in front. It is paratracheal, anterior cervical. Which one? Anyone? B. You think it's all of you think it's B? Let's see. So now you have your buccal group of lymph nodes. See, these are the set of lymph nodes which are present in the head and neck region. Now we have to see scalp, which posterior aspect of the scalp. You have anterior aspect and posterior aspect. The posterior aspect extends up to, extension of the scalp itself is up to the eyebrows, okay? In front, up to the eyebrows here, and at the back, external occipital protuberance. So that is roughly here. So roughly here, external occipital protuberance. So what group of lymph nodes are present in this region? So this region is only the occipital group of lymph nodes. So you both are correct. It is answer B, occipital group of lymph nodes. But don't, forget to be little more observant and see what other group of lymph nodes are present. We have preauricular parotid lymph nodes, we have submandibular, submental we have, and we also have some cervical and retroauricular lymph nodes. All these are also present in the head and neck region. Okay. So next one, dermatome testing point for the biceps reflexes. Now you have to ignore something, that is whatever supplies the hand you can just ignore. They're talking about biceps, which is present in the arm region. So you just concentrate on the arm only. Okay, Suman? Suman is my very dedicated, always there, student. 5-6, C5, C6, both of them. Which one is for triceps? Which one is for biceps? Which one is for biceps? Which one is for triceps? Think. Now in the arm, both are there. Is it C5 or C6? Suman, any idea? Debian? Suman thinks it's, Debian also thinks it's C5. See, with little push, you're able to think. That's why you need something like this so that you can get motivated, right? Otherwise, you wouldn't have thought. This is hand region. So immediately you should learn to, eliminate what is not a good option. When you eliminate, you will have few choices. See, it's not just in the, MCQs. Even in life, you have to learn to eliminate what is not important for you. Right now, you are preparing for your PG. All these extras that come in your banner, like pandemic and all that, you have to just, push it aside. And then you should work towards your goal. Otherwise, it becomes too many things on your brain to retain what is needed. Okay, you may lose focus. So don't lose focus. Here also don't lose focus. Just see, this is not required for this particular question. Ignore. Okay, we'll just concentrate on C5, C6, C7. Let's see now. Okay, now this why I said ignore, because this is got, yes, Suman. Thank you. So this is C8 and T1. Now here, see, this is the dermatome testing point. C8, little finger, C8. This T1, now here, just proximal to the elbow joint. And see here the myotome, middle finger flexion. Middle finger is applied by, see, anything that says digitorum goes to the middle three fingers. Now digitorum, 3 different tendons. Digitorum profundus. So middle finger flexion, if the person is able to do, then it is a testing for C8. Then there is little finger abduction, testing for abductor digiti minimi. See, all these abductors are intraossei. But which intraossei? Anybody? Which intraossei test for abduction? Is it palmar or the dorsal? DAB, DAB. You remember DAB, yeah. Suman knows it because she has attended my classes before. So this is abduction. Okay, so that is with the intraossei. So you have to remember it is the dorsal intraossei which, help in the abduction. So this is abductor digiti minimi for little finger abduction. And we were talking about biceps. This is biceps and brachialis, the myotome. So elbow flexion, and the dermatome testing point is the lateral antecubital fossa. Okay, so there is this lateral part of, the biceps flex, because where does the tendon go? Where does the tendon go? You know that the tendon goes to the radius. Okay, there is a tuberosity. It goes to the radius side or the radial bone. So you have to remember it is on the lateral side. It's not radial, radius is not on the medial side, it is on the lateral side. So this is why lateral. Okay, that is C5. And C6, you remember, it is supinator reflex. This is also very, very important. Supinator reflex is C6. Next, so you have to remember the elbow, wrist extension, elbow extension, and triceps reflex is by the C7. Which one is by which one? You have to have some idea. C8 and T1 also is important, but C8 is little more important. All right. Next one, the craniofacial development. In the craniofacial development, there are various things that you need to keep in mind. There is paraxial mesoderm and lateral plate mesoderm. What is the other thing? Anybody? What are the various things that we have to remember? One second. Students, just give me a second. Okay, who can answer? Are you physiology? No, physiology I do take, but they give classes in which we are, proficient. I do take, otherwise I do take physiology and microbiology, but on this platform, I can't take physiology and microbiology. Yes, biochemistry, I don't take. So, see, chemistry is, I'm little away from chemistry. I don't take. The chemistry I studied only when I was doing my, the embryologist course. That is the only time I made an effort to study biochemistry properly. So that is, we needed all this biochemistry knowledge and biotechnology knowledge we needed. And that is the only time that is for ART course, assisted reproductive technology. Otherwise, biochemistry I haven't. Okay, so there are staff at Unacademy. There are good staff. They would be taking biochemistry and physiology. All right. Okay. Okay, now tell me, in craniofacial development. Oh, thank you. Thank you. Thank you. Because I was outside the country for a few years, so it has just come and it is not going now. Yeah. So if you are in teaching line and, it becomes a part of your thing. It's not that you want to pose or you want to do something, but it is very difficult to remove it. And I also have students from abroad, a lot of students. I have students from China as well. So all these students, they don't understand the typical, the Indian accent that we give. They have a lot of issues with that. And so sometimes we have to just keep it this way only. Okay. So now can anybody answer this question? In craniofacial development, paraxial mesoderm contributes to which of the following? Now this is embryology question. How many of you are very proficient in embryology or just learning? Who knows this answer? What is paraxial mesoderm? Any idea? Okay, now I'm going to just add a slide. There is occipital bone, muscles of the tongue, extraocular muscles, none of the above, all of the above. Which in craniofacial development, paraxial mesoderm contributes to which of the following? Now, let's see the answer and then we'll go back to see all these things. Extraocular muscles, is it the muscles? Muscles of the tongue, occipital bone. Let's see what is the answer. The answer is E. Okay, it contributes to all of the skeletal muscles of the head and neck and bones of the base of the skull. Bones of the base of the skull would include occipital bone, right? Occipital bone. So now here I'm going to quickly add a slide and I'll just show you what is you have to tell me. I'm just going to quickly draw what is this. Okay, only then I'm going to label it. What is this one? Okay, what is this one? And what is this one? And what is this one? Tell me what are these? I'm just going to shade it a bit so that you get some differentiation. What is this one? Which one is notochord? Yes. Next. What is this? Anyone has any idea? What is this one? This is paraxial mesoderm. Yes, this one is lateral. There is one more, that is the lateral plate mesoderm. This is lateral plate mesoderm. Okay, what is this one? Okay, this one is intermediate mesoderm, lateral plate mesoderm and intermediate mesoderm. So these are some of the things that the mesoderm is divided into. It is divided into paraxial, lateral plate and intermediate mesoderm. So now tell me what are the derivatives. Now what are the derivatives? Who can tell me what are the derivatives of, let's see, with the lateral plate, or we shall go for the paraxial mesoderm itself, because we were talking about this. We were talking about the paraxial mesoderm. Who will tell me what are the derivatives? Skeletal muscles and bones of base of skull is what you just understood, right? Occipital bone. Okay, now tell me. I'll write it here because there is more mess there. So you can see this is divided into the head and the somite, and this is somite. You have heard of somites, right? Okay, this one is again divided into the sclerotome, and it is divided into sclerotome and dermatome. Okay, now the sclerotome, what are the derivatives of sclerotome? Anyone has idea what is the derivative of sclerotome? Sclerotome gives rise to vertebrae and ribs. Okay, vertebrae and ribs. Then what else it gives rise to? It also gives rise to body wall and limbs. Okay, endotome, that is aorta derivatives. All right, yes. And it is also having this arthrotome. So that gives rise to joints of vertebrae. Okay, that is one thing. And then there is one more. What is that? It gives rise to the tendon, ligaments, all these. That is called syndotome. Okay, that is about the sclerotome. Now coming to the dermatome. Now dermatome, you tell me dermatome gives rise to all these things like the myotome. And then there is plus myotome plus okay, this is what gives rise to the skin, dermis, like she mentioned, and then there is skeletal derivatives. Okay, so whatever we wrote here, this is this one. Anyone has any confusion here? Anybody has any confusion? So where is the skeletal derivatives and the bones of the base of the skull coming from? It is coming from the paraxial mesoderm, which I wrote here, and that gives rise to head and the somite derivatives. Okay, so head, there are many other things that is derived from there, and like the muscles of the tongue and also the extraocular muscles. That is one section. And then there is this somites. They give rise to all these structures. But first of all, it is divided into sclerotome and derma myotome. And derma itself should give you indication that those muscles which are very closely associated with the skin and also dermis of the skin, all this is the derivative of the somite. Okay. All right, so there is no other intermediate mesoderm. Yes, there is this paraxial mesoderm, and this is intermediate mesoderm. We'll come to what we'll do is we'll take up a separate session on this, okay, on this mesoderm, and I'll tell you about the derivatives of intermediate, lateral plate, and also paraxial mesoderm. I will tell you the trick to remember. How did I write so quickly? I'll tell you how to remember. Okay, so you watch for my class. Maybe in another 2-3 days, I'll have this. Okay. All right. Yes, it is yolk sac, but I will tell you how to remember it is. Okay, next one. Let's move to the next question. The craniofacial defect that is illustrated in this picture below was most likely caused by which of the following? Which of the following do you think causes this? Craniofacial. See, you can see there is this area, and you look at the nose and look at the how much it should be. It should be around 9.5. Right? So see this, the width. Premature fusion of sagittal cranial suture, premature fusion of coronal cranial suture, and overgrowth of frontonasal, incomplete fusion of frontonasal and maxillary, incomplete migration and differentiation of cranial neural crest cells. What do you think? I feel that head is conical. Okay. So the A and B, you mean A and B? We'll see. The answer is B. Okay. So now this is a typical hallmark condition which is called the Eppert syndrome. Eppert syndrome, in which the coronal suture fuses prematurely, most likely due to defect in the, there is some defect in the FGF signaling. So this is one thing that you must remember. Okay, 1 second. This is stuck a little bit. Okay, now what is Eppert syndrome now here? What are the other things that we can list here? Eppert syndrome. Anybody has any idea? What are the other things that we can, list? What is that? You tell me. What are the causes for the Apert syndrome? Now it is passed. Is it genetic, first of all? Is it genetic? Is it inherited? It is inherited, okay? It is inherited. And then what is it? Is it autosomal dominant or recessive? It is a autosomal dominant trait. Okay. Yes, that is bulging eyes. That's also true. And then what else is there? There is a faulty gene. Which number? Number 10. Okay, there is a mutation in the gene number 10. Just remember this. Yes, maxillary hypoplasia also you can see, and there is occur without family history also. There could be mutation in the number 10. So these are some of the things that we can list in the Apert syndrome. So cleft palate could also be accompanied with the other, syndromes. So now here the main defect is, with the mutation of the gene number 10. Asymmetrical face is the main thing that you can notice in the patient. Yes. All right, let's go to the next one. With that much information, we will have a separate class on the genetics. I'm going to start. That time I'm going to tell you each and every, thing that we can list. I'll tell you about Treacher-Collins, Apert, Downs, Klinefelters, everything we'll list it out. So that time you will know the difference between each one of them, right? Okay, the condition shown in this picture below was most likely caused by. Now, what is that thing that you can notice here? What is that one thing that you can notice abnormal? There is a facial defect, yeah, that you can notice. There is a cleft, okay, from the angle of the eye to the medial angle of the, angle of the lip to the medial angle of the eye. There was a picture, you won't believe. I went as an examiner to some college, and I saw that there was a model and embryology model, and they had drawn it so wrong. It started from here and it went to there. So that, the model itself was wrong. It was somewhere, and I don't want to mention the name of the college. It was really, it was really heartbreaking for me, because even the staff didn't know that. So that was really pathetic. So yes, medial canthus, they have to. This diagram is perfect. Whatever is there in this on the screen is correct. So this is oblique facial cleft. Now tell me, why does this happen? Why does this happen? Debian, why do you think this happens? Now the options are here. Failure of medial and lateral nasal process. Is it medial and lateral nasal process? Just see, is it true? Incomplete merging of maxillary and mandibular won't come. So this is not the option at all. It is not gone to the lower jaw at all. Wherever mandibular is there, first delete that. So I'm eliminating, okay? I'm eliminating what is not at all relevant. So we let go of this, let go of this. You decide between the other things. Overgrowth of frontonasal, that also we can cut it off. It's only the failure of medial and lateral nasal process, incomplete fusion of medial nasal process. The answer here would be the medial and the, see here, the medial and the lateral nasal process. This is the process that you can see, lateral nasal process you can see. So that results in, this one, failure of medial and lateral nasal process to fuse with the maxillary process. So those two don't fuse with the maxillary process, that results in a cleft or a gap between the lateral nasal process and the maxillary process. Now, actually, there are 5 different processes which should fuse by the week 6 of intrauterine life. Okay, so 5 processes you can see here itself. You can see the frontonasal process, you can see mandibular, you can see the maxillary, medial nasal, lateral nasal. Okay, so all these 5 processes you can see, and that is what is going to form the symmetric face. And when some things don't fuse, it leads to cleft palate, cleft lip, and also to the oblique facial clefts. Okay, there could also be, there are very rare condition that this leaves a bigger gap. There is sometimes a small gap that is seen. What is that called? There is a sutural line that is seen sometimes. Do you know what is the name of that sutural line? Of course, 100% it is fused, but there could be a line indicating that there was 2 different right and left. No, it is called metopic suture. It's called metopic suture. This should fuse, by the time the child turns 8 years of age, around 0.6% of population. This could still be there, and we had an X-ray which showed this some time back. It's very rare to find. If you find, just keep it with you with the metopic suture. Okay, next one. The thyroid gland is derived primarily from which arch? There are various arches, pouches, clefts. Now, which arch? Or is it the arch, first of all? Is it the arch? Is it the arch or the pouch? E, foramen cecum. So it is not the arch, it is not the pouch. The answer is foramen cecum at the base of the tongue. Correct. So now the answer is E. Debian said E. Thyroid tissue is derived as the endodermal, diverticulum, which starts from the floor of the tongue at the junction of anterior and posterior. So this is where you will see the foramen cecum. So this is seen here. And that is supposed to descend downwards and complete its journey, okay, within the first few weeks of intrauterine life. So now here sometimes what happens is it just doesn't descend down, and it may just stop in front of the hyoid bone, it may stop in front of the thyroid cartilage, or it may overshoot and go into the thoracic region. So all that could be the possibility. So now here that a small portion of thyroid develops from ventral portion of pouch 4. So remember this, the pouch 4, it is also called the ultimobranchial body. So pouch 4, it is not the just the cecum, you remember the pouch 4, but a small portion only, which is negligible portion, okay, and which is invaded by the neural crest cells, and that becomes the C cells of the thyroid. So it is the C cells that are derived from the pouch 4, and that is ultimobranchial body. So if thyroid is asked, then you still stick to your answer, that is foramen cecum as a thyroid diverticulum or endodermal diverticulum. Okay. Function of which one? C cells. C cells, what do they produce? C cells, very important function, we should know this. The function of C cells is to produce what? What do they produce? C for calcitonin. Yeah, calcitonin. It tones. What does it tone? Like Boost, Bonvita. What does it tone? It tones your bones. Okay. So remember, the bone density is good because of calcitonin. Or who is the opposite? Which hormone does the opposite? The parathyroid. So parathyroid hormone level goes up, the bone density goes down, the blood calcium level will increase. Okay, when parathyroid hormone level is high, that indicates blood calcium level is high. Yes. Next one. Which of the following clinical findings is observed more frequently in association with the DiGeorge syndrome, but not usually in Treacher-Collins syndrome? Which one? Which of the following clinical findings is observed more frequently in association with this syndrome, but not usually in Treacher-Collins syndrome? Anyone has this? If you don't have an idea about the embryology and genetics more, we could start with those classes. T-cell leukopenia, B-cell leukopenia, palate and pharyngeal abnormalities, facial abnormalities, external ear abnormalities, which one? The Treacher-Collins syndrome, you must remember it is mostly the one which affects the first and second, which are going to lead to the facial abnormalities. Okay, so because the first arch is mandibular, the second one is hyoid, so both of them derivatives. If you see the mandibular arch, all those muscles of mastication and the cheek region, the jaw region, all that is affected, including the development of mandible. The hyoid arch has all those muscles of facial expression. So there could be the atrophy and, absence of some of the muscles and derivatives, including the derivatives of the ear ossicles. Ear ossicles are also derived from the first and second arch. So the person will also have the deafness. This is one of the important feature. Okay. Next, whereas the DiGeorge affects mainly the arches 3 and 4. So third arch and the fourth arch, these don't have names. Third and fourth one, involvement of some of the involvement from first and second itself. So symptoms unique to DiGeorge include thymic hypoplasia, because thymus, is derived from there. That is leading to absence of T lymphocytes. So you have to remember. So they are immunodeficient. And there is also parathyroid gland hypoplasia, resulting in the hypocalcemia. So this is a very important thing to note down. Okay, you have to remember the thyroid, superior and inferior parathyroid glands. Superior parathyroid gland, inferior parathyroid gland. Superior one is derived from the third one. The inferior one is derived from this is from the fourth one. This is derived from the third one, the opposite. Why? Because of the migration. Okay. So this is because of the embryological origin. So the superior one is from the fourth, this is from the third. Now, in addition, the DiGeorge syndrome also has outflow tract defects. So there are various tract defects like the auditory pathway and the visual pathway defects. All right. This is what, whereas the defects are more rare in Treacher-Collins. So because that involves only 2 arches, this involves 4. But the features of the first and second is not seen much. The defects of third and 4 is more in the DiGeorge syndrome. So please know, this is very, much asked question. This is asked because you can see the features on the face, right? They have this hallmarks, classical feature that, you know, there is hypognathia. So all these small mandibles, small maxilla, all this you can see, and other features. I'll just list out all the features of Treacher Collins. I'll show you the picture. You'll be able to describe it better. Next one, among the pharyngeal arches, its derivatives are innervated by hypoglossal nerve. Which one? Thymus develops from the third pharyngeal pouch. Yes. Okay, so thymus along with which one? Along with which one? Thymus and which parathyroid? Superior or inferior? It's together. Okay, remember this way. You should always do grouping because the questions are asked like that. They could, club this, and this could be one question. The thyroid is developed along with which other, structure from the third pouch. So just answer this question, Shruti. What is the answer for this? Among the the pharyngeal arches. Now, what derivatives are supplied by the hypoglossal nerve? Hypoglossal supplies, first of all, what? What does it supply? Hypoglossal supplies what? What muscles? Tongue, right? Tongue muscles. Now, is it first arch, second, third, fourth, fifth? What is sixth? Is it there? A, C, D. All the intrinsic muscles of the tongue are innervated by hypoglossal nerve, and tongue is derived from the arches. That's why 1, 3, 4. That's why the answer 1, 3, 4. Okay, so A, C, D. That's what explains 1. A is 1, C was 3, and D was 4. Okay, so only tongue. So tongue is what we are describing again and again. All right, next. Which ones are innervated by the facial nerve? Any idea which ones are innervated by the facial nerve? It is not temporalis, it is muscles of mastication, so no. Is it pharyngeal muscles? These are supplied by the vagus. Masseter, no, because that is mandibular. I'll write M. This is also mandibular, M. Muscles of facial expression, F, yes. E and F. What about muscles of facial expression? Are they not innervated by facial now? Yes. Is it anterior belly or posterior belly that is innervated by the facial? Posterior belly. Anterior belly is mandibular. Occipitofrontalis. In this, only frontalis muscle was, is the one which is innervated by facial. They're not the other belly. What about auricularis? So what are the things that we need to pick here? It is C, E, F, G. Okay, let's go back. C, E, F, G. Look at C. This is the one. E. Okay. F. Some animals can also move their, ear muscles. Auricularis, there is one, there is superior, there is posterior and anterior. There is no inferior. So there are 3 muscles to this. They can move their muscles and they can turn, like rabbit. I have 2 rabbits at home and they do that. Yes, I can, I will have to go see them again and see in what directions they move. So that is auricularis action. So C, E, F, G. Okay. So where is F? We have F here, auricularis, and then there is G, that is posterior belly of digastric. What about stylopharynges? Anybody has any idea what is stylopharynges supplied by? Yes, I have one brown, one white. Ninth one, yes, glossopharyngeal. Yes, nice. Glossopharyngeal. What about stylohyoid? Usually people get confused between stylohyoid and stylopharyngeus. Stylohyoid is supplied by which one? Any idea? Stylohyoid is supplied by ANSA. Hypoglossal. Hypoglossal supplies the stylohyoid, and one more starts with T. What is that? Only two muscles it supplies. Rest all are supplied by the hypoglossal and the C1 nerve root, which forms the ansa cervicalis. Now, which one alone supplied by the hypoglossal? Think of this hypoglossal supply, and I think looks like we have to do one cranial nerve session, and that will be giving you a lot of answers to all these unanswered questions. So we'll do one cranial nerves. That also something I can think of. All right, posterior belly of digastric is supplied by facial nerve. Yeah, embryology also. All right, so with all this, I think I should stop here because if I take up next question, it will overshoot. And big thank you. Okay, big thank you to all of you who have made this class really nice. Okay, so this is my code. Just in case you have forgotten, this is the code. Don't forget to use the code. Go look for my profile, ROHINIYN. Okay, look for this. And this is my username, Ro Aqua. So with all these, you can find me under NEET PG section. So see this, and thank you, Suman. You are very generous in your compliments. Thank you so much. Okay. Yeah, you have a good day. See you all. Bye. And don't forget my 10 p.m. class. Join in for those, nice mnemonics. Yesterday it was very interesting, mnemonics. So every day we are doing 5 mnemonics. Very, very important 5 mnemonics. I'll tell you how to remember those 5 different topics with just 5, kind of mnemonics. It's a sentence-based mnemonic. It's very easy. And the sentence also relates it. You will get a hint. Okay, like for example, median trap was the mnemonic for all those causes for carpal tunnel syndrome. What are the causes for carpal tunnel syndrome? So these are some of them. So you will be surprised. What is M? What is E? Like all this myxedema, edema, diabetes, idiopathic, and what is A? That is acromegaly. N is neoplasm. See how I get it? How do I get it? Because of the mnemonics. So we can do this more. I have today also at 10 p.m. Join on YT. Okay. See you all. Take care. Bye.